So then later it came in Italy. So when some football player was playing, and all of a sudden he was falling down in the field he died actually with a sudden cardiac arrest. So if you think about heart, so the heart is beating every second. So that means the muscle of the heart is when any of these two things get imbalanced, this could lead to working in a gym or going for hiking or playing football. Those kind of things could lead to a sudden cardiac arrest. So the underlying cause for this arrhythmogenic cardiomyopathy is, and for the medical students, they do medicine 5 to 6 years. Then in between, they also do a medical thesis for a year. They get notes or grades to say, and then whoever is in the top grades, they get into the medicine faculty or medical studies actually. But then there are exams there where you get filtered out patients, because whoever is having private insurances or so, they will be treated differently.
Okay.
But we have the Gastroenterology in Germany. So it's like a government. Once you are into the postdoc, one has to realize that within 3 to 5 years after you enter into the postdoc, you should get out of the postdoc system. That means you should.
So, Dr. Yeruva, thank you very much for coming to my podcast. I know you as a distinguished scientist in the field of biology, especially in cardiomyopathy currently, with more than 20 years of experience in the research field. Even I had a chance to work with you almost like a stretch of 4 to 5 years. So with that, I would like to start the podcast with a question in a simple term. Could you please tell us what is cardiomyopathy?
So before I start explaining you about cardiomyopathy, let me thank you for inviting me for your podcast. This is my first podcast, and I'm very happy that I'm doing it with you. And cardiomyopathy, basically the name itself tells you about that it's a disease of cardiac muscle, so which is our heart. So the muscle, the heart muscle is affected in the cardiomyopathy, and there are different forms of cardiomyopathy. So there is hypertrophic cardiomyopathy, there is diabetic cardiomyopathy, there is arrhythmogenic cardiomyopathy. So everything has its own forms or pathological causes. So what I am working with is arrhythmogenic cardiomyopathy. So where the patients have symptoms like fibrosis, and then arrhythmia is a major symptom, and eventually acute physical exercises, or like example, working in a gym or going for hiking or playing football. Those kind of things could lead to a sudden cardiac arrest. So the underlying cause for this arrhythmogenic cardiomyopathy is a kind of a mutation present in desmosomal genes, which are important for coding proteins that give mechanical strength to the cardiomyocytes. So cardiomyocytes are the functional units of the myocardium in the heart. So if you think about heart, so the heart is beating every second. So that means the muscle of the heart is the working unit for the heart, and so all the cardiomyocytes are connected with each other in a place called intercalated disc. That's where you find the proteins responsible for giving mechanical strength and conductivity to the cardiomyocytes. when any of these two things get imbalanced, this could lead to the dysfunction of the cardiac muscle. So this in the way is very important, that um, these proteins should work all the time in a very normal manner. And the presence of mutation in one of the desmosomal genes could bring a imbalance to this function of the cardiomyocyte. But in general, patients live up to 70, 80 years. But it depends about their lifestyle.
Okay.
So some are not doing any kind of physical exercises, so maybe they can survive. But then, yeah.
So, uh, physical exercise or hiking or whatever, so they are not causing the myopathy. The mutation is causing the myopathy.
Yes. So
only the people who is carrying this mutation should be careful, or
no. So there are only 60% of the patients who carry mutations in these genes. Okay, in desmosomal genes. But there are also people with mutations in other genes like that code for, let's say, gap junction protein or TMEM. There are other ion channels and so on. But these are very less in occurrence. And there are 40% of the patients where there is no definite causative factor, which we don't know yet. Yeah, it's still open book kind of thing where we still have to work on it.
okay.
Yeah, but if you take the majority of the patients, they have mutations in one of those desmosomal genes. And once you know that in a family there is a mutation, then it's easy. So then you can screen the whole family members. Then you know how the mutation is carried forward in the generations, and then from then onwards one can be diagnosed like whether they are under any kind of for example, whether they have arrhythmia. If you can do ECG and then check if they have kind of arrhythmia or any kind of symptoms. If they don't have, then you can keep them under observation. So regular checks, and I mean about their heart function, and then other parameters that can tell you like whether the heart is functioning well or not.
So, if I correctly understand, the cardiomyopathy is sudden stopping of beating the heart.
No.
Okay.
So it's a disease of the cardiac muscle, which could lead to
Okay.
a sudden cardiac arrest.
Not in every case.
Not in every case.
Okay.
Not in every case. So there are people, for example, there could be in a family, the daughter or a kid, or it's not the kid, but the child can have a mutation, and the parent, one of the parent can have a mutation. And there were instances where the child or the child, when reaching teenage or so, they were doing strenuous exercises, going hiking somewhere or playing football. Then all of a sudden they had a cardiac arrest.
So, finding the mutation is only the way to be careful in this case.
Yeah, if you know that there is a mutation. So
Okay.
so this is easy because it's 60%. In 60% of the cases they have mutations, right?
Okay.
And now already it's known like what are the genes that can be affected, where you can look at, yeah, for which genes. These are not many genes, yeah. But then there are also other clinical parameters like syncope means it's kind of when you are feeling all of a sudden dizziness or it's you cannot concentrate, or you fell down one time all of a sudden. And these are the small things that are telling you that there is some kind of problem.
Okay.
But then it doesn't mean that all the time you go into dizziness, it has something to do with cardiomyopathy.
Okay.
But then if you then see in the family, they have some kind of a gene mutation, then you can correlate with it.
Or I can genotype my
Yeah, you can
yeah.
do that. So but nobody is doing it because it also costs money, right? So
Okay.
especially in a system like a German system where without any symptom you cannot go to the doctor and say please do my gene sequencing. This doesn't happen.
So so otherwise I can be detected by ECG.
Yeah, definitely. If you have arrhythmia, then there is a definite chance that you can go to the doctor and say, could that be,
But
you
how do I
know,
know that I have arrhythmia?
yeah, these are, as I said. So when you are doing something, all of a sudden you feel like
Okay.
the dizziness and they frequently happening,
Ah.
yeah, or you have palpitations, like you can feel like your heart is beating in a different rhythm. Sometimes you feel like it is beating very fast.
Oh.
You are doing something, right, or some kind of work, and then you have palpitations, and this could tell you kind of okay, there is something wrong with me. Then you can go to the doctor. Then they will say, okay, let's do a 24 hours ECG.
Oh.
And if it is a really there is something present in your heart, it can be detected there.
It's a 24 hours continuous ECG.
Yeah, they put 24 hours ECG, they record your
Okay.
things, and they ask you to do the normal daily things or what you do. And then if it is there, it can be detected.
Okay. Okay.
And once it is detected, then there will be process. I'm not familiar with the clinical aspects of it, but then once you go to the doctor, then they have their following task force criteria, it's called. So task force criteria 2010, where they undertake certain parameters. They look at the troponin levels in blood, and those kind of some blood parameters are there. And then they can also look at, as I said, now ECG, and then they could do MRT, and then look into the heart, whether there is a fibrosis in the heart. These are the things that the doctors can evaluate further.
How severe is this? Like in the
The
number of people in terms of
it's 1 to 5,000 to 1 to 1,000.
oh.
It depends the geographical area. So actually, this the whole thing came from Greece island actually. So there, some patients had this kind of arrhythmia and woolly hair. So it's also kind of because of one of the gene that is responsible for desmosomal addition, both in the skin and the heart, is the desmoplakin.
Uh-huh.
So when they had mutations in this kind of desmoplakin gene, so it can affect both the skin and the heart,
Okay.
because in skin also we have desmosomes. So they give the mechanical strength to the keratinocytes.
Uh-huh.
So because the skin is also another tissue where it undergoes a lot of tension
Yeah.
in the tissue, like same like in the heart, because heart is beating, skin is always undergoing external environmental stresses. So it can stretch, like at your elbow it is stretching and relaxing, and those kind of areas. And also in the winter, your skin is being exposed to cold weathers, and then those kind of things can have the effect on the skin. So those are the things that can cause certain phenotypes.
Uh-huh.
Yeah. So then later it came in Italy. So when some football player was playing, and all of a sudden he was falling down in the field he died actually with a sudden cardiac arrest. And then they started doing this gene sequencing, and it came out that in the Italian population they have a higher frequency of these gene mutations.
Oh.
Yeah.
So if you are diagnosed with this mutation, so the first and foremost thing is you should not do acute exercises.
Yeah. So the first things that is known now already is that if once you are diagnosed with a mutation, or when you fall into this task force criteria, then the doctors will tell you to avoid strenuous exercises. So you will be put under beta blockers majorly. This is one of the treatment is symptomatic. So they want to, you have arrhythmia, so then they want to reduce the arrhythmia. So then they give you beta blockers.
Okay.
So that's a major thing that is going on right now. And then they also ask you not to do strenuous exercises, just because when you do exercise, your sympathetic nervous system is getting activated, and this could lead to arrhythmias in the heart. So to avoid that, they want you to avoid exercises or strenuous exercises, and then you will be put onto beta blockers. You can have a normal lifestyle, like you can walk, you can go to work and do things, but then you should not stress yourself much. That's the thing.
I just got an idea. I'm revealing openly.
Yeah.
Hi. The motto of this channel, Wisdom Vibes, especially the podcast part, is not only to bring extraordinary people and expose their achievements, but also to expose the extraordinary qualities in ordinary people, because we believe that podcasts are the best way to instantly pass the information from the previous generation to the upcoming generation. To become successful in our mission to reach our podcasts to many people around the world, we need your subscription. So please subscribe and share the values by sharing the videos. Thank you very much. So why, for example, if why don't we make it as a startup, and then for example we will develop a quick mutation identifying system technically.
Yeah. In a population, you mean?
Yeah. In such cases, what happens is like the cost can come down, and people also can, independent of their insurance system, they can come, then pay maybe couple of, maybe 100 or I don't know dollars, and then get their genotyping done, especially for this mutation.
This could be a good idea, but now after COVID, things have changed a bit more. In the sense, now this is also there is a kind of ongoing research post COVID, how this can affect the heart, because one of the, during the COVID infections, one of the major tissue that got affected because of coronavirus is heart. And also there were incidences where the vaccine was also affecting the heart right now. So what can happen is that now, even without gene mutations,
Okay.
we can also have this kind of the COVID infections could also lead to it's not cardiomyopathy, you cannot say, but then they could now give a kind of similar symptoms like cardiomyopathy.
COVID infections.
Yeah,
It's a bit scary, right?
it's a scary thing. That's what if you now look at what is happening in India, every now and then all the youngsters who are in a really kind of physical exercise, like kind of they are dancing in a disco, or they are doing garba or whatever, yeah, all of a sudden they are collapsing because of sudden cardiac arrest. And in India, we don't have the kind of post-mortem things, because yeah, nobody is really checking up why the patient died, or what was the reason. But then I think also there are some clinical developments are going on, which is not coming into in terms of research articles where everybody can learn about this.
Okay.
I'm sure that the doctors in India are also working on this, why there are so many sudden cardiac arrests going on, but then nothing is coming out as a knowledge for the common people. Maybe in some years it might come, but then there is research going on then also, that how COVID infections could affect the heart. And there are already some publications where they showed that there is myocardial inflammation, which then again it's again causing the muscle dysfunction, and this could be also another cause. Long COVID effects are also there. Yeah, so this can also affect now heart. So, and And what is more important to know is that the hypertrophic cardiomyopathy or the diabetic cardiomyopathy, they also share similar symptoms like arrhythmogenic cardiomyopathy.
Oh, okay.
So this is again another task that is which we cannot really figure that out.
Distinguish.
We distinguish. These are mainly clinicians who are really able to do that with a certain clinical diagnosis and those kind of things.
Can
But
we?
definitely, if people are aware of these things and they want to use this opportunity, yeah, if there is a company that can give for very less price, at least certain, you can take some 10-20 genes, and then you can screen for those mutations in those genes, and then if you can give a package and then they can do it,
Yeah.
it should not be a bad idea actually
Okay.
to take it in a different way.
So does stress also can aggravate this?
Yeah, I mean anything that can activate your sympathetic
Ah, okay.
or act. So right now that's how the focus is. But we are also working in a different perspective that whether is it the activation of the sympathetic or is it the activation of the parasympathetic
Okay.
that can cause this outcome of the sudden cardiac arrest, or the balance between the activation of the sympathetic and the activation of the parasympathetic. If they are not balanced well, and
Okay.
if there is a higher parasympathetic tone,
Okay.
then this could then what is it is doing is it makes the heartbeat go down completely, or the beating frequency go down, and it could go down to a level where it cannot come back probably.
So it's interesting to know, right? So
Yeah.
for every heartbeat is controlled by some sympathetic nervous system
Yeah,
is trying
the
to
autonomic nervous system.
maintain the
Yeah,
beatings, or
yeah,
raise the beats,
yeah.
and parasympathetic nervous system is trying to control, slow down,
Yeah, yeah.
and the balance is
The
very
balance is
important.
very important.
Yeah.
In a physiological level, this has to be balanced very precisely.
Yeah.
This balance cannot go wrong.
Okay.
Yeah.
Coffee affects arrhythmia.
Um,
I mean, because these days
yeah,
there are a lot
too
of
much coffee, but I don't, as far as I know, I don't think so. But I'm also not
because there
100%
are a
sure.
lot of
There are other factors also.
complementary.
Yeah, yeah,
Yeah.
yeah.
Okay. Now, can you a little bit tell about what you are exactly doing as a scientist in Germany?
Yeah. So right now, when I come in terms of cardiomyopathy, so that's where my focus is. So we are focused on arrhythmogenic cardiomyopathy, and as I said, that 60% of the patients carry mutations in genes that code for the desmosomal genes. So then we ask the question: so how could this one single mutation in a gene could cause such a drastic disease? So is it the mutation? Because there are patients who are living normally till 80 years,
Okay.
yeah, who carry the mutation, and that's under certain medication, under certain medical diagnosis, yeah, and they can live more than 80 years. But then there are 15 to 20 years old teenagers who are dying all of a sudden without knowing that they carry the mutation. Yeah. So then our focus was when I joined the lab in Munich. They found out that the sympathetic activation could lead to desmosomal increased desmosomal addition. So basically, if you now correlate it to what the sympathetic doing to the heart, so it is always doing positively increasing the heartbeat or the heart frequency, yeah, and the conduction velocity of the heart goes up, and everything goes in a positive way when you have a increased sympathetic activity. So in the same sense, we found out that it can also increase the adhesion of the desmosomes. So that means two desmosomal molecules coming from two different cells, they bind with each other with such a strong binding that this leads to formation of a mechanical strength between two cells, and this is very important. The moment this bonding is gone, there is no cellular adhesion, and
Okay.
For a cardiac muscle to work, they work as a sensation, functional sensation. So they have to work in a continuity. If any of the continuity is broken, then there is
The rest of the muscle doesn't get the signal.
get the signal,
Okay.
and this could lead to the sudden cardiac arrest. It depends, like how much is the loss. Is it one cell or 1,000 cells that lost the connectivity? Then the effect would be stronger. Maybe one cell, two cells, then still the muscle can overcome the things. But then when it is beyond certain capacity or beyond certain threshold, then the muscle cannot compensate. Then it's a problem.
Okay.
So, coming to my point, so that's where I joined the lab, and then I asked the question: okay, the sympathetic is is increasing the desmosomal addition. Then what does it do if the parasympathetic is going up? Does it affect? Because the parasympathetic activation leads to reduction of heartbeat, heart conduction velocity, everything. Yeah, that comes under the heart function. So then, is it also similar to what we see in the heart function that can also happen at the desmosomal addition? And eventually, we came up to the point that yes, it is also same like how the heart is functioning under the parasympathetic. So the desmosomal addition is also going down with when the parasympathetic is getting activated. Then under the presence of sympathetic tone, so where there is the sympathetic tone is higher, and at the same time, if you activate the parasympathetic, then this is reducing the effect of the sympathetic on the desmosomal addition. And we found out the mechanism, also which pathway and those things. And now we want to go further and see whether this will affect the gap junction protein function. So which is an important protein for the conduction velocity across the the myocardium. So where across all the cardiomyocytes. So if this protein is not functional, then also it causes complete loss of the electrical
gap junction.
the gap junction, electrical conductivity, and this can lead to arrest of the heart, cardiac arrest.
Okay.
So now we are focusing into this direction, yeah, and then we also want to find out treatment options that can increase the desmosomal addition under a pathological setup, what we find in a patient. So what we are trying to do now is we have like iPSCs that are isolated from patients, and then we want to study now under on these iPSC derived cardiomyocytes how different treatments are working. Whether let's say we have treatment A, treatment B, treatment C. Which of these treatments can better the cellular cohesion, so the addition of the cells
In vitro.
first, because these are coming from the patients. So you can see whether this treatment is working on this patient derived cardiomyocytes. So which could be then directly translatable to at least to the humans, because we don't have many human models in the cardiomyocyte field. Mostly we work with either mouse hearts or samples from biopsies from patients at the end stage of a disease or something like that. But you never have a proper cardiomyocyte cell line. So this is the thing that is going on now, that iPSC derived cardiomyocytes, or now people are also creating hearts, small hearts from the iPSC, and then they are trying to study the heart function.
That's interesting.
Yeah, that's what is going on, and that's where we are now focusing. So we want to find treatment options by under a setup where desmosomal genes are mutated, whether we can still rectify using different treatments. So this is our focus. So yeah.
As a scientist, do you, apart from this, what are the other things that you are responsible in your lab?
So basically, I'm also involved in teaching anatomy. So not a classroom or a theoretical teaching, rather practical teaching. So
You teach anatomy practically.
So in the sense, we work with human cadavers, and then I teach to the first year medical students complete macro anatomy. So on complete whatever you can see with visible eyes. So we teach. So we dissect the whole human body except the brain, so which goes under neuroanatomy. So then we work with the complete whole body with all the muscles, bones, and then ligaments, whatever we have, and then all the inner organs. So from the thorax, from the abdomen, everything is prepared, and then they demonstrated to the students, and then yeah, so they learn practically what they learn in the from the seminars, theoretical seminars.
Okay.
So this is my part of my job, and yeah, this is what I do.
And you teach in English or?
It's kind of there is no compulsion, but I teach in German.
Okay.
Yeah, but still I should say that it's not up to the native speaker level, but still I get also how do you say feedback from the students, and they also give ratings for our lectures. So till now I never had any issues in that sense, because I mean mostly it is Latin that you speak in terms of Latin words, and then you can explain easily on the body. Yeah.
Okay. Okay.
So that way it's not an issue.
Yeah. So as a scientist, actually, we know a lot of varieties of human diseases, which actually normal people don't know outsiders. So that's the
Yeah.
only common things.
Yeah.
So for that, to target those treatments of those diseases, we also need constant funding,
Yeah.
and a constantly new generation is coming to the field of medical field as well as research field.
Mhm.
But what I heard is like countries like Germany, there is a lack of force, like medical students,
Mhm.
also like doctors. So do you know anything about that? A little bit elaborate about that.
Yeah, actually, if you now come, there are 2 points here. So you are asking one thing in academics, the other thing is in the medical field,
Yeah.
right? So I mean, they both are interconnected, but if you separate them, academics in the sense research-oriented academics, medical students means then they are focusing on to being a medical doctor and treating patients. But in Germany, most of the time, the medical doctors are also involved in research,
Yeah.
which is sometimes is more stressful for the doctors. Yeah. So now coming to the point from the starting, so the academics. If you come to the academics, it would be like there are PhD students joining the lab who does PhD, and then they either go out of the lab and become postdocs, and then at one point of time they have to have their own lab, like that means they have to become professors. So this is the career path
Yeah,
for
it's a
a
typical
biology student to say.
Yeah.
A MSc passed out biology student, the career path is like if they want to take academics or research as their career, so then they go do PhD, postdoc, let's say from 3 to 6 years on average, and then become independent scientists and then professors. This is the path. And for the medical students, they do medicine 5 to 6 years. Then in between, they also do a medical thesis for a year. So either they take a break, semester break in between, and then they do 1 year of their thesis either in the clinical field, or they come to a research lab where they have a proper research oriented question, and then they learn techniques, different techniques regarding the question, and then they can do their thesis and then defend them. This gives them the opportunity when they are being medical students, they also get exposure to the research.
Oh, okay.
So as I said, since in Germany, most of the medical faculty, not the faculty, the doctors who are in university hospitals, let's say, they have the compulsion to do research.
Yeah.
So for them, it is a stepping stone, what they do as a medical thesis. And then after medicine also, there are some enthusiastic doctors who wants to do a bit more research. So they can also do a couple of years of postdoc, so let's say. So they go to either US or some other labs, and then they gain more experience in research, and then they come back and then they do research. Okay, so these are the two paths. How they both can do research, right? Now coming to the point, lack of you're talking about lack of personnel
Yeah.
in medicine, and then lack of opportunities for the new aspirants in science.
Yes. To
Let's say
become
academics.
yeah.
Yeah.
Yeah. Yeah.
So there are two aspects. Now I'll come to the research side. Yeah. So typically it's very relatively easy to get into as a PhD student, because there is funding available. There are many research labs who wants PhD students. It's easy to hire a PhD student rather than hiring a postdoc.
Yeah.
But then from there, every PhD student should get a proper guidance of how to mold their career, right? This is one step. But even then, so there is always the PhD project is not working for everyone. There are some highly risky projects that might work or might not work. If you are lucky and you get through, then you get a good publication, then you go into a nice bigger lab for your postdoc, and then you do good publications in your postdoc. And then the important thing is, once you are into the postdoc, one has to realize that within 3 to 5 years after you enter into the postdoc, you should get out of the postdoc system. Means you should publish, you should get your grants, individual grants, whether it's small, big, whatever, and then you find your path for the professorship. So that means you have a window from the time of start of PhD till you get a independent grant is somewhere between, let's say, 6 to 10 years.
Yeah.
This is the window where you have to publish, you have to get independent grant, at least one grant.
Okay.
Then there is a chance to become successful into going into professorship.
Okay.
If anything in this during these 10 years goes wrong and you cannot establish yourself, then you don't have a comeback. But what I'm talking is only about academics.
Yeah.
Either you choose academics, or after your PhD, between the first 3 years of postdoc, you still have the chance to enter into pharma
Industry.
or industry, to say. You have to be really quick to assess yourself and say, okay, this is not my career path. I cannot sustain here. Then I jump out of the academics and then I try to find an industry.
Yeah. Because
Then-
whether you are intelligent or not, you're a hard worker or not.
No, you need
doesn't
luck.
Yeah, you need.
You need pinch of luck.
Okay.
Without that, you could you think that this project is very interesting, but then within the given time, you might not be successful.
It's not the case, and
And
finally,
here, time is more precious, because once you cross 5 years after postdoc and you cannot get yourself established in the field, then it's very difficult. You have to be really, really lucky to get into further career path. Yeah, so that's where the system is now getting more stressful.
sorry,
yeah.
the information that you're giving right now is very, very useful for a lot of
PhD or the aspirants, new young
right now.
aspirants.
Yeah, that's the reason
Yeah.
why I'm digging out
Yeah.
into this.
So
details.
this is the pathway, and especially in Germany, if you are coming to Germany and you want to make your career pathway, my suggestion is, when you start PhD, start learning German.
Okay.
So
German language.
German language. Yeah. Without that, you cannot. I would not say it's 100% that you cannot go up the ladder, but the chances to go up the ladder to become a professor or head of the department are very less. Yeah, because to be into that level, you need to be able to communicate in German language, because there are so many steps in between where you have to communicate with multiple people who might not have a proper understanding of English. So then it has nothing to do with your science. It has something to do with your administration. where everybody is into German. So that would be a bottleneck at one point of time.
Yeah,
So
even medical students, or almost all the total study of medical field is
yeah,
in German, right here.
yeah. So the
Because
medicine,
people
yeah,
usually might think that a country like developed country like Germany, maybe I think people
yeah,
know on higher level everything is in English, but it's
no,
not the case.
no.
Yeah.
So actually, by when I came in 2004, and when I now see after almost 20 years, Germany in that sense changed a bit, but still it's a long way to change it completely. Yeah, so they are a bit more conserved in that sense. Like there are people who the documentation system, everything is in German administratively, so they
Yeah.
cannot, if
I
they
mean,
have to change, it takes a while. Yeah, in research it will work as long as you are in the lab and you are doing your research and publishing. That's it.
research is in English.
Yeah, research is in English. You there you can sustain, but then that's what I'm trying to tell you, that if you want to be into professor ranks, then this will not help you.
Yeah.
So if you want to be just a postdoc for 10 years, yeah, then it will still work, but this is not the career that you want. You want to go up the ladder. For that to happen, you need German. Without German, you cannot get successful. Even if you jump into the industry, till certain level, you can be successful. Or if you are lucky, you go into an international company, maybe then you don't need a German. But if you are into a German company, and you want to go up the ladder there, at one point of time, the bottleneck would be your language.
Yeah, of course, because they have their own language, and then they study
Yeah,
and they understand better, and
everything.
that's how they
Yeah,
build up
yeah,
their economy, everything.
yes.
Yeah.
So, and also, I mean, there are always exceptions in the sense there are multi-talented people who can serve people, they want to have you, and then they could still give you some kind of exception that okay, it's okay, you don't have to have German, but then this would be like
Very less.
I can count on my fingertips. Yeah.
Okay.
So that way, it is very important to have German. Yeah. So this is for the academics, in my experience. Yeah. And when it comes to the medicine field, there are many medical students who are starting, but then almost 30% will drop out because of the stressful learning or the curriculum that they have. So it's not always easy to sustain the stress. Yeah, there is too much to learn, and then 30% would be just filtered out.
Okay.
Yeah, either they are not passing all the exams, they are taking forever, and those are the things. Yeah. So in a German system, it all works without any exams. So it is like they get notes or grades to say, and then whoever is in the top grades, they get into the medicine faculty or medical studies actually. But then there are exams there where you get filtered out.
Oh.
Yeah. So 30% will be filtered out. Then maybe maximum some 70% or 60% are going through. But the problem here is now the younger generations, they don't want to take that much of stress, especially like being doctors.
Okay.
So they want to have a proper life, in the sense work-life balance and all those things.
So doctors they don't have
Yeah, I mean, if you want to be in a clinic and you want to do research in a university hospital, that means you are working 80 hours a week, not 40 hours a week. Yeah, and especially if you are in a no, like emergency rooms, yeah, or in surgery, the life is different there,
Okay.
right? But the younger generations are nowadays, I had the opportunity to talk to some medical students who are working with me, what they are thinking. So what they are saying is, we don't want to have that kind of stressful life. We
So
are
they
happy.
realize only
No,
after
they want to work only not full time. They want to work half time in the university hospital. They want to go as consultants to other private hospitals, something like that. But then it gets restricted to some patients, because whoever is having private insurances or so, they will be treated differently.
Okay.
But then we have the gesetzliche Versicherung in Germany, so it's like a government funded health insurance kind of system, where then you have to go through the university hospitals. It's a proper process, like a long-term process. There you will be treated by the normal doctors in the university hospitals or the praxis or the like family doctors and so on. But then these are not there are not many, right? So there is a deficiency going on in terms of number of doctors they have. So what I learned is that in my last 5 years, that most of the not most but majority of the percentage of the medical doctors, when once they finish, they are trying to find either places like Switzerland, where they are paid well, they have less stress,
Okay.
or they are trying to go away from the university hospitals and go to small clinics where they have a 9 to 5 kind of a job.
Okay.
Yeah. And but then they cannot treat all the patients. That's a major problem. Most of the patients will be treated at the university hospitals. So those are the bigger hospitals where they have surgeries and emergency situations, and everything will be dealt. And then when you go into the smaller clinics, it's like diagnosis kind of. It's okay for going to check that I have fever, and those small things I have dizziness. Then they do the ECGs,
Blood
those
parameters.
blood parameters. Those are the small things they will do. If it comes to terms of surgery, they cannot. Yeah, if it comes in terms of MRT or radiology or something bigger, then you have to again go to either specialized areas like radiology centers or MRT centers or whatever. It's a different thing. But then you are not dealt by your family doctor. But then you have to go to eventually to a university hospital, where then again there is a deficiency of the doctors.
Doctor, can we? I mean, is it beneficial for Germany to invite more students here from?
Yeah, that's what the Germany is doing right now. So they are trying to take doctors from outside. So they want, if you have done medicine outside, and if it's equivalent here, or you are already a doctor with some clinical experience, but then you cannot come directly and have a job here. You need German again because your patients are Germans. Then you need to communicate with the patients in German. So then that means then you have to know minimum communicable German means a B2 level German.
So there are two barriers that if they could cross, then
Yeah.
they can actually have a bright future here,
Yes.
right?
Yeah. And in my friend circle, I know at least 3 to 4 doctors who came out from outside, like from India, and then they are doing very good here. There are neurologists and ophthalmologists like that. They are doing nicely. And yeah, but then they have invested time in learning German for a year. Yeah.
And here, education system. I mean, education is free. So if someone wants to start studying medicine here,
Yeah.
what is the criteria? So like they should come after
So
+2.
after +2, they can come here, and then the first and foremost is they have to learn German till C1. So there is a special course for the people who wants to do the German, medicine. So then they have to pass the exam, and afterwards they need an equivalent exam that they have to take, because here they also learn mathematics and biology together. And when people are coming from India, so
Yeah,
they have
study biology, I
they
don't
have, they
study-
have BPC and MPC, and then for them BPC, then they don't have maths, and they have to give exam into that category.
Yeah.
And then once they pass these two things, then they need marks also, which they can convert into their grades, and then they can enter into the medicine. So what is good here is you don't have to pay lakhs or crores of money
Yeah.
to do medicine in
Yeah.
Germany. It's free in the sense you have a semester fee of maybe now it's, I don't know how much it is, but somewhere around 500 to 750 euros per semester, which is equivalent to, let's say, if you take 500, it's like 50,000. Yeah. So close to 50,000 basically, or 45,000. So 45,000. So maybe a lakh per year means which is very much affordable to, because you can come here, you can also do part time, you can pay your own semester fees. Yeah, but then the only costs are the living costs.
Yeah.
So where I know that many European students are coming here and then they do part-time jobs, and for the first 2 years somewhere in either university bibliotheques, or they can work in a restaurants or
Heavy
so,
jobs.
heavy jobs and so on. But then once you passed out of the first 2 years, then you can even work in clinics.
Okay.
So there are this private clinics where they will hire you for helping as a, not a nurse, but then as an assistant, in a clinics. Then they are paid in the sense they can cover their living expenses.
Okay. What I like is here is the money that you have is not determining that you can become a doctor.
No.
The determination of you to get the grades,
Right.
and then to learn the language.
That's it. And then you have to have the will to become a doctor,
Okay.
and then you can do it.
And then of course you will enjoy what you're doing
Yes.
after that.
Right. And then if you are going through the medical studies here, yeah, then you don't have any issues. Once you are done, you have a job to find. Yeah.
Okay.
So that's as easy as it can get.
Okay.
And especially now, to my knowledge, there is a lot of deficit in medical doctors, and they are looking for people to replace.
So, in recent developments that we have seen that the robotics are coming into the surgeon field.
Yeah.
So, what's your opinion on that? So,
Yeah, definitely. I mean, this is going to be, either advantages or it could be disadvantages to the new aspiring surgeons to say, because especially if you take Germany, where you have a shortage of doctors, then they want to implement this robotics because
that's how they wanted to
want
compensate.
to compensate the shortage, right?
Okay.
But then at one point of time, if this is working, then you don't need any more
Surgeons.
surgeons,
Okay.
or you don't need that many surgeons,
All right.
right? One surgeon sits there and then he can handle the robot and then do everything, and it's very precise basically.
How likely is that to happen, and how fast?
Actually, as far as my knowledge is concerned, there are surgeries already going on in that direction.
Okay.
So where they are using robotics to do the surgeries, and now with the invention of AI, I don't know how fast this can grow, and maybe you see it. That can change many things for the future, especially like countries like Germany where they have shortage. They would definitely want to, and they are investing into it. They are investing into the so it's called KI, Künstliche Intelligence.
Yeah.
Yeah, so and they are investing a lot into that now, even in medicine. I mean, for me, it's a cause of concern.
Ah.
What I feel like, because robots are robots at one point of time, and but then they can also be precise. Yeah, so there should be one person who can control them. But then when you lose the control, what can happen is the issue. But then you never know what is going to come up.
Oh yeah. Oh, yeah. So, you came here to Germany in 2004, almost more than 20 years back.
Yeah, or almost 20 years back.
Yeah.
Yeah.
So, I just want to ask you. So those days, so you came to do your PhD.
Yeah.
Could you please share some those days? How you used to be, internet used to be, or your library or access to library publications, your lifestyle there, and now comparatively.
So I tell you, so what I found the major change from 2004 to here is in terms of internet.
Yeah.
There was no easy access to internet for us at that time. It was either too costly for a student to afford, or it is very least available because we didn't have smartphones. So you don't have internet in your smartphones. So then the only place where you can get internet was your lab, if you're working in a lab, or in a student hostels where it was per month 2 gigabytes.
Okay.
So, so that was the situation. But then it was also a good thing for us because then I know all my Indian community or the students who are in biology all over Germany. Just because we didn't have anything to communicate, so I could communicate with my friends over phone, and then we are in touch with each other over phone. So
So you mean this kind of communication is better than effective than social media
yeah,
communication? Okay.
because then I like we are talking to each other. Then we are so if my friend is going to another city, so like whom I came to know in Göttingen, let's say, then I have another friend from my masters who was there in Hanover. And then I told to my friend, this friend, okay, my friend is there. You can go there and you can meet him. And since there was no other means of, how do you say, kind of
Communication.
not the communication, but means of fun to say.
Ah,
Since now you have smartphones, you are addicted to YouTube. You don't want to communicate with others.
shorts.
Yeah, shorts,
Netflix.
Netflix. You are watching many things on your phone itself.
Yeah.
And if you look at people when you are traveling in a train, everybody is into their phones. They don't even look at your face. Those were the days when you communicate. Even when you go into a bus, then the fellow sitting next to you is saying hello, and you are looking at his face. So those were the days. Now it doesn't happen. Yeah,
Okay.
and those were the days when we were far away, but we were still close enough.
Okay.
But now, what I have seen in my recent past is that people are in student hostels. They are in one room, they next to each other.
They don't know each
They
other.
are communicating via the Facebook,
Or they don't know each other.
or they don't know each other. Yeah.
Yeah.
So these are the major things that I found differences in the community. But yeah, coming to research wise, this changed a lot. Now, let's say now I'm traveling every day an hour in the train, and I want to study an article. In those days, you have to print, you have to have it in your bag, and then read. But now I'm traveling, and all of a sudden I'm thinking, okay, what is happening with the desmoglin 2? Then I take my smartphone, I can just search
Yeah.
and then get connected to the article, and then I can read. So the moment you get a thought, you can use it for yourself. So it depends how you want to use it. Yeah. So that way you can improve your science, or you can use the time in a better way. So even I'm traveling half an hour, I can use the time to read something about my research or to gain some knowledge, which was not the case at that point of time.
Yeah.
So this is to look in a better perspective, how it changed things.
Yeah.
Or I can also communicate with my family. Right at that time, we
At
had
that time,
only telephone cards,
Yeah.
and which were coming for €5, and you can talk for half an hour. So if you don't have that, then you cannot communicate with your parents. Now we have WhatsApp. Then I can, whenever I want to talk to my family, I can talk. So this is another advantage.
Yeah.
But then still, this is making people far away from each other also, because then you have in your WhatsApp some thousand people, and then you are fed up of having WhatsApp also. So this gives you some,
Yeah.
kind of distance. Yeah.
Yeah.
But probably it depends. Maybe it's with the old generation, but the new generation is dealing them with a different perspective. But this is what I have seen in the advantages and disadvantages.
Okay.
Yeah.
In terms of the availability of Indian food then and here.
Oh,
Now?
this changed a lot. So then, when we were here, of course, there was a Indian, the Sri Lankan shop where we could get some Indian food, and if you want more, then we were going to Frankfurt and getting things from there.
Yeah.
And now you see how many restaurants are there in a small town like or a city like Göttingen. Yeah, but and in our times it was only there were two, or no, three actually: Delhi Palace, Maharaja, Maharani.
Okay.
Yeah, but now you get everything. Yeah, now you don't even have to go to shop. You can also order everything online, and then everything comes, all the Indian food comes
Yeah,
to
yeah.
your home. So things have changed definitely in the last 20 years. Now you know how the Indian community in Germany. So everybody is settled. They are having their own apartments, or we got settled down well with the proper jobs and all those things. And the other people are looking at you differently also. Now they know that, okay, Indian community means they are IT people or biology people, or at different positions. Now they nobody is like looking at you, oh, you are doing Dr. Robert. It doesn't happen now.
Meanwhile, India also started growing
Yeah,
rapidly in
rapidly.
last
Yeah, so
decade.
things changed a lot. Yeah.
Okay,
And in that matter, I think also Germany opened up a lot compared to at that point to now.
that's cool.
Yeah, you hear or you hear English in most of the in everywhere in the
Yeah.
in trains and all those things. And you see more like they want to introduce now English as a second language. So they are changing. So they
Now you are in your journey to become a full-time professor.
Mhm.
That's your
Yeah,
that
this is
your
my
aim?
now I'm going. I mean, my next plan is to make a habilitation and then go into professorship.
Okay. So with that, I thank you very much for your time, and I wish you all the best.
Thank you very much for having me here, and I hope my information is useful for. Yeah,
Very informative.
yeah.
Yeah.